All right, guys, we're live. Good evening, everybody. Thanks so much for joining us. Kind of I think a passion of all of ours is to make ourselves healthier and in turn help our practices, help our patients, our families. Really, very impactful thing we can do for ourselves first ends up helping everybody else around us. And so happy to have with me tonight some pretty special people that have influenced me to take a closer look at our overall wellness, mental health. We have Kyle Stanley here from California. We've got Martin Mendelson here from Arizona and Israel Putterman from DC. We're missing one. Ricardo Madrani is in school. He was supposed to join us, but he's taking classes on something very well related to what we're talking about tonight. Um, and he's going to try to join us maybe for a few moments if he can. If not, we're certainly this isn't our last opportunity to get together and talk about something that's so important for dentistry. You know, I would consider Kyle and Martin really the experts on this topic and as influence upon me as a clinician to figure out where I was at and what I needed to do to feel better. Really came from my initial meetings with Martin at Spear and then with Kyle later on through friends that we have in dentistry. And really, to start off with a story, I think it's applicable for myself is that had a pretty awesome career in dentistry. It really everything seemed to be going my way until the stress begins with family. It was for me, it was mainly one of my older childs going through somewhat of a mental health crisis and how that comes into your own mental wellness. What do you do? What are you going to put into action to help that young child succeed through the struggles she was having? And you have to take a deep look at yourself to get through that, and to process that amongst a very busy practice. To make the time to do that is a huge obligation, but something that's absolutely necessary. Um, and we can I think dig a little bit deeper into our personal stories as we go along. But I want to share the table with um, start with you, Israel, if you don't mind. I think you and I share this other topic in mental health awareness, and that's ADHD. And um, so if you want to kind of tell your story too, and then we'll hand it back off to Kyle and Martin.
Sure. Yeah. Well, thanks for putting this on, and really, it's great to be with you guys and seeing everybody's stories here and what you guys have made out of it, especially Kyle and Martin, who have just taken the reins on this topic in dentistry. It's great to see. Um, for me, it really has been, ADHD is something that I didn't really know much about growing up at all. And I knew that certain things I was good at, certain things I was really not good at. And, I'm one of those kids who heard 1,001 times, if only he applied himself. And it's not so much applying themselves ourselves. It's really about what, certain tendencies and certain things that we are better at than others. And it was really much later on in life. This is just the last 2 or 3 years that I started to look at myself and had some family things go on and really started to look into it. Okay, I need to really find out how I can help myself best, how I can help myself succeed best. And one of my kids was has ADHD, and I started to look at the similarities and see that okay, a lot of the things that he goes through, I'm like I go through the exact same things. The apple didn't fall far from the tree in that respect, and so I decided to take ADHD test with a psychologist, and lo and behold, it was one of these simple online tests where you're set up in a quiet room and it's really just choose shape and color and it was 20 minutes or so. And the first 2 minutes, I thought it was a joke. And by 15 minutes into it, if I had hair, I'd be pulling it out. It really was crazy. It was the toughest test I've ever taken. And I remember meeting with the psychologist afterwards and telling him that it was impossible test. And he goes, "That, my friend, is something only someone with ADHD says." And, I met with a psychiatrist afterwards and verified, and same result came through and said, "Well, okay, this is what you got to do." And, it involves so many factors, acknowledgement, coaching, self coaching, things that we do for ourselves that help us succeed. And realize that even though I didn't have the diagnosis all the years, I already did all those little things. Had so many systems for everything to stay on track, without the actual knowing what it was for. And in the last few years of just learning more and more about it, it's fascinating, and it's something that's it's never ending to learn more about, and it's always adaptation to do all the little things to help ourselves do well. And like I said, there are some things that we do better than others, and there's some things that we do worse, like everybody in life. And it's just that we tend to have clusters of things that affect us all.
No, that's awesome. I'd love to, hear what Kyle and Martin have to say about it. But my guess would be that there's a lot of dentists that have this same condition. It's our very high type A personalities kind of, I think, come a little bit from this ADHD bloodstream. So,
Well,
uh,
if you're not already a type A person, or if you're not, what is a nice way of saying this? Detail oriented. That's how I say it nicely. Not anal, we're detail oriented. If you're not detail oriented, when you get into dental school, they sure beat it into you over those 4 years, right? So I think no matter what, we all come out with a certain personality. And something that I heard in Israel's explanation of his story, it's something that Martin and I discuss a lot, was just understanding yourself. I think it takes so long, I thought I knew myself my whole life, and I realized I didn't really know who I was till I was 35. And even then, like over the last 6 years, it's already, things have changed. But I really started to understand who I was, what my limitations were. Like Israel said, what I was good at. I thought I was kind of good at other things. And once you have that awareness, then you can go on this journey. And I think it's a never-ending journey. But that awareness is so big, realizing you have a problem, realize something's changing. That's, I think, the biggest thing that Martin and I are trying to get across, if anything, is just have this awareness, look internal. Martin, what do you think?
No, absolutely. I was actually just looking up there's a study on this by RADA where dentists are prone to professional burnout and anxiety disorders and clinical depression owing to the nature of clinical practice and, quote, the personality traits common among those who decide to pursue a careers in dentistry. And so we're all unique, yet we're all alike at the same time. And I've never thought of it this way. But yes, the majority of my one-on-one coaching clients who also are dentists also have been clinically diagnosed with ADHD. Never thought about it before, but how interesting is that? So it's the whole realize element has a multitude of meanings in my own personal life and my own personal journey, but it's like anything in our lives. The first step has to be the realization that I have a problem or that I'm unhappy in the way that things are, and that things can change no matter who we are, where we are, because we've all survived 100% of our worst days. And so I know I have, and I know many of us, all of us on this live have, and I have every confidence everybody listening or will listen has as well too. Life is not easy, and nobody ever said it was. It's how we actually navigate the choppy waters of this thing called life that actually makes the difference between happiness and the opposite.
It's funny
Yeah, and
what
I think
Israel said is, he started to understand, for him, it was ADHD, right? For me, it was understanding burnout. Like, what is burnout? What is it? And there's this great quote that one of my jujitsu professors says, and he says, "A problem understood is a problem half solved." And I think that was exactly it for me, was once I understood what was going on with me, it was much easier to solve the problem. Not that it was easy, but it was much easier than when I didn't know what it was.
Yeah.
We wait till
And
all the time in the why. Why is this
Mhm.
happening?
Yeah. Yeah. And I have to say, from my own personal journey, I was interviewed recently on a different podcast, not Kyle, my podcast, but a different podcast. And I realized that my low points, one was forced on me, and the other ultimately was of my own doing. So the first was becoming disabled from dentistry. That wasn't my choice. I couldn't do anything about that. Was out of work for 17 months in 2003 when there was no Google, there were no smartphones, there was no internet like it is today. And that was just devastating and traumatic in the true clinical definition, as I learned later in therapy. And, I would literally get up every day and think to myself, what am I going to do? And so I found this song. It was a cover actually by Heather Small. One of the lines is, "What are you going to do today to make yourself feel proud?" And in those dark days, even if it was like one thing that I could do, make a phone call, send a letter, send a resume, do a research on something that I could possibly do for a living, then that was a successful day. And I didn't realize it at the time, but it was my first foray into stop putting so much pressure on myself and just be grateful for those baby steps. Because at the end of the day, that phrase that everybody knows, a journey of 1,000 steps starts with a journey of 1,000 miles starts with a single step. It's true. But we all give lip service to it. And I don't think many of us really embrace it.
Yeah, and I think that, to kind of reframe this, we obviously have four, there's supposed to be five super successful dentists here. And our purpose in this was really to open up that discussion, to make sure that all those people that are out there listening and follow us, that, hey, it took us a lot, all of us took a lot to get here. But how important is that to be able to share that it's okay, that this is something we all must do, to open up and talk about our hard days, our wounds, our battle wounds. That's where this thing has to start. And then once we've opened the discussion and the awareness for it, where do you go? What do you do? What are going to be your first steps? So I think that for me, it was, as I mentioned, just having the realization these were dire times. It involved one of my children, and I had to step up. I had to figure out what was most important to me over career, over the busyness of growing an organization. That all had to play second fiddle to mental health for my child, but also for myself, because I was being torn up. Worse. I mean, I've lost parents young. I've been through a lot of traumatic experience with death, and nothing was quite like seeing your child suffer.
Well, it makes
And
me think, it's kind of like what Martin was going back to, is sometimes it doesn't hurt enough, so we don't make that first step. It's like I heard this expression or story that there's this dog sitting with his owner, and he's sitting there, and someone comes up to him, the dog's whimpering, and he goes, "Why is your dog whimpering?" He goes, "He's sitting on a nail." And he goes, "Well, why doesn't he move?" And he said, "It doesn't hurt enough." And I think that's how it is for a lot of us, right? I mean, Martin didn't have a choice. Something happened, right? You didn't have a choice, Todd. Like, you had to do something. It was your child. Um, I didn't do anything until it hurt so bad, or until I actually just thought about quitting dentistry. So I had to make a change if I wanted to stay in dentistry. And that's the unfortunate problem I think we have, because people always ask me, like, do you think you have to hit rock bottom in order to make a change? It's definitely easier to make a change if you've hit rock bottom, but I don't think you have to. I hope that you don't have to. I hope that people, I went like this, crash, come back up. But I hope that people could see my story, see them changing a little bit, and just have it be a little blip in the system. But I don't know. I'd love to hear your guys' thoughts on that.
Yeah, I mean, I think for most of us, we're pretty resilient. So it takes a lot more to call to action.
Are
'Cause
we
we're-
resilient on the outside or on the inside, though? Because I think a lot of us are resilient on the outside.
yeah. Yeah, I mean, I don't know
Because
whether
we
it's
have to be, right?
right.
A lot of us are, I was just looking up this study that a lot of dentists are forced extroverts.
Yeah.
You know, we're not extroverts, but every day we're, hey, Mrs. Jones, good to see you. And oh, hi, hey, welcome to the practice. Da, da, da. And that can be challenging over the long term. So I think a lot of us are resilient in the sense of like, we will grind and hustle to get anything done because we've done that our whole life. We had to do that in finals and in boards and in live patients and in, you know, whatever, being an associate and starting a practice and owning a practice. Like we just grind and get through it, right? But I don't know if we actually stop and look when we have a problem. I don't think we're as resilient internally as we are on the external.
Yeah. But whether it's, you know, we're really good at battling, right?
Yeah.
And I think that
Mhm.
because of that, it's going to take something major to get us to rethink that and to think,
Yeah.
hey, maybe we're not as tough as we thought we were. And something's gotten so bad here that I need help. That's, I think, the what I want to make sure people out there listening is that it's okay to get there. And if you think you need help, you probably do. And there are resources out there to help you through this stuff. If it's nothing more than knowing there's someone else suffering like you, that's a comforting feeling, because until you know what you've done with Lightside, Kyle, and it's really brought up the discussion, right? It's gotten us all to say, hey man, it's okay if these guys can be out there to the world talking about their woes, then so shouldn't I. And so I think that's a powerful thing that you've done, is to get us talking about it. And then
Yeah, that's been a big takeaway. Like Martin and I just did our Lightside Live, which is our 2-day workshop. And one of the biggest takeaways that people said was, I'm just happy to hear that I'm not the only one and that everyone else is going through the same shit that I'm going through. And
Yeah.
it's like,
Yeah.
you know, you don't want that. You don't want that like, oh, great, everyone else is going through these hard times. But there is something nice about knowing you're not the only one, because when I was at the bottom, I thought I was the only one. Because on the outside, everyone looks like everything's great.
Yeah.
And isn't that always the case? No matter what it is, who you are, what the situation is, we as humans make up this story that we're the only one. We're the only one with an addiction problem. We're the only one with mental health issues. We're the only one that's, you know, like us in whatever way that is. Isn't that interesting that we all do that all the time? And it's Todd, I guess it was, well, whoever said about you know, we don't move until it's bad enough. It's interesting because I've never thought of it that way before, because I'll give you an example. I was just at the LA Dental Symposium last week, and I keynoted there, and it was a wonderful experience, and people were so kind, and I was almost like just avalanche with people pulling me aside, asking me if they could talk to me, really being very heartfelt, etc. And you know how many of those people have called me since then? Now, the easy things have happened. What do I mean by that? Like the people who said they wanted me to speak for their organization, great, they've already called. That's easy. But it's the hard stuff where in the moment, because I guess they had an emotional experience, it caused them to move. But then later it's like, well, I guess I'm okay. And you know what? None of us, all of us are not okay on every, you know, other day or whatever number of days. And that's got to be okay too. What's not okay is the ultimate sacrifice. And unfortunately, there's the rates of suicide in our profession are too high. Now, there's a fallacy that it's the highest of any profession. That's not true, but it's what, Kyle, 17% higher, 17 times higher than the incidence in the general population.
Yeah.
That's too high. And we suffer in silence because we're sitting on a nail and we think our nail isn't big enough.
Mhm.
You know?
Well, it
Yeah.
is hard to think our nail isn't big enough. Why? Because we're doctors, because
Yeah.
we're small business owners, because
Yeah.
we're well educated, because we're in the top 5% of earnings in the world, probably. And so I think that's why it's so important to talk about it together,
Yeah.
because it's hard to get sympathy from someone else that's not a dentist, because they're like,
Mhm.
but you're rich, but you're educated, but you're a freaking doctor. You drove up in a nice car, you live in a nice house, you have a beautiful family, you're happily married, but it's hard to get any sympathy if you're successful. And we see this with celebrities as well, right? I mean, you see Justin Bieber, whenever that was 10 years ago, going through this problem, and everyone goes, how could he be so depressed? He has $300 million. He's, he's a great artist and he's wrote all these great songs. Like, he's still a human after all that.
You
I
know,
think that's what people forget.
it's funny, we've mentioned, the suffering and woes and things like that. And I guess this is what's great about what you guys are doing, is that you normalize the discussion of things. That it doesn't, you don't have to wait until there are woes and suffering. You
Yeah.
can just discuss the small little problems that we all
Mhm.
have. And those add up and then they become bigger problems. But you don't have to wait until there's a nail that's big enough to bother you to move. It could just be the little splinter that you can discuss, and it's normalization of it. And I guess I've always heard that, and I see it in my patient population, that DC has, I think it's the second highest rate of psychologists or mental health professionals.
Mm.
Not a big shocker. Second highest rate in the world. I think Rio de Janeiro or something like that is
Huh.
#1. And yeah, I have a ton of psychologists as patients. So maybe just here, it's not a big deal. Everybody sees a therapist here. Everybody
Mhm.
goes to a psychologist. It's
If we can normalize, like, it sounds like what's happened in DC, if we can normalize that in
I don't know about
dentistry, like
normalizing DC because it's a crazy city.
every city is wild. Every city has their crazy people. But even like my goal is to have 1 hour of mental health training every time you have to renew your license. Another goal I have is having one speaker at every event, like symposium. I'm not talking about an individual course, but like if it's at AAP or AACD or, AMIS or any of these, like there's 3 days of people talking about surgery and restoration. Let's have one person talk about resilience, positive optimism, mental health, something. And if we can just normalize that conversation will happen. Those conversations will start happening at lunch and beforehand. Oh, are you going to see this person? I'm kind of feeling like this. And then everybody's out in the open, so that we're still going to have depression. We're still going to have anxiety. We're still going to have challenges. But I don't think we'll lose as many of our colleagues dying by suicide that we would, because now it's swept under the rug. And so then they feel alone, and then they feel like there's no way out. So you're
Totally.
exactly right, is that if we can normalize the discussion, that would be a huge thing, just normalizing the discussion.
Yeah, and I think, I think that's why we're here, right? I mean, I think that's an awesome thing that you kickstarted, Kyle, is that now we're having other people that are willing to come talk about this. And I think, if we could do something tonight, and that is that there's obviously a lot of silos in this. There's really bad, there's suicide, there's deep, dark depression, but there's also something that at least Israel and I have, and that's ADHD, that's helped us immensely in our education and our careers, to systematize things and to be completely anal retentive about things. That's it's almost a gift. And,
Mhm.
dentistry as a whole, because there's such a high rate of that condition, which I think can be very positive for us. That's almost a positive discussion we could have with our colleagues. Whereas the other side of it, the really dark part of this is we need to get some people out of some pretty bad places. What
Yeah.
do
Mhm.
we do to set this up for them where they've got a simple first call or a first thing that they can do to break away from their darkness. So I think there's if tonight, if we could really, have a little bit of a conclusion on the good, right? The fact that we're dentists are very hardworking. Hopefully, most of us are doing it for the right reasons, and that's for our patients. So there's an ethical bond to being a healthcare provider and doing it really well. And then there's conditions of which we have because of our training, or even before our training, like you said, Kyle, that if we weren't so anal retentive when we started dental school, we sure were when we left.
Yeah.
And so there's this kind of positive edge that we have to help us perhaps cope in a high stress situation. But then there's the folks that are suffering and they haven't been able to they have not been resilient. They're losing.
Yeah,
How
it's funny what I like what you said there, Todd, too, because it makes me think of something that I know Martin and I have seen with our courses and things is when a dentist decides that they're going to change, they're excellent students because that's what we've done our whole life, right? I mean, we're lifelong
Yeah.
learners. We're always taking courses. We take notes and we study and we watch videos. Like they're good and they get through it and they make these changes. And then what's interesting, which is similar to what happens in alcohol recovery or narcotics recovery or sex recovery or any type of addiction, is that they then finish and want to help so many other people. And we've seen this time and time again. Once you have someone that goes into a dark place, comes out of it with some resources, has a community, then they start wanting to just share about it and talk about it, which is awesome because that's what we need is like these little ripples of water all over the world in their little cities or counties or dental associations that start talking about this. And then it becomes normal. You have all these these positive influencers around, and we can make a huge difference.
Yeah.
I think too, in my very first coaching program, and I'm approaching my 10th anniversary, which I can't believe, there were a number of foundational principles that really changed the trajectory of my own life, specifically how I thought about my own life and what I bring to my clients. And one of which is you are exactly where you need to be. And I love what you said, Todd, around specifically ADHD and how it served you. Because it did serve you. And now we're at a place where it's no longer serving. So then the question becomes, what are we going to do about it? And the other foundational principle that I absolutely love is we are all at choice. And so we always have a choice as it relates to how we're going to then take our next steps in our lives. And I would love everybody to just at least embrace that one concept. We are all at choice. And one of the foundations of my work today and my passion and my purpose is a quote by Dr. Viktor Frankl. And Dr. Frankl was a neurologist, a psychiatrist, and a Holocaust survivor who survived the horrors of Auschwitz to come out the other side to become an internationally respected thought leader. One of his international bestsellers was called Man's Search for Meaning. And in this book, there's a quote which has become the foundation of my work, which is this: between stimulus and response, there's a space. In this space lies our freedom to choose our response. And in our response lies our growth and our freedom. That quote is what gets me out of bed in the morning. That quote is at the cornerstone of my work. That quote is why I'm so grateful to be doing what I'm doing with Kyle, because there is always hope in the darkness. And the only thing that's going to bring hope to the darkness is light. And so when we can shine light on this and we can bring this out of the darkness and say, you know what, it's okay. And people like us who are on stages that people look up to, when we get up there and say, you know what, I wasn't okay, I'm much more okay today, but I also have my days, is such a powerful thing. And I want to publicly acknowledge a company that everybody knows in dentistry, and it's Ivoclar. And Ivoclar had little old me, the short guy with a bow tie, talk to their North American sales meeting. This was a sales meeting. And they wanted me to talk about how optimism, the science of it, can drive strategic growth goals. And now I'm doing this for Seattle Study Club, for the American Association of Endodontists, for the Canadian Association of Endodontists, Chicago Midwinter. The list goes on and on and on. And so there is hope in the darkness. And I just hope so many of us who've seen the light can pass the torch, and those that are in the dark are willing enough to take the torch to move forward in their own lives with a bit of light.
Yeah, that's awesome. Yeah. Yeah, no, that's I think if everybody just hears that little bit right there, that's a powerful start to this, is that there's a lot of hope for you to bring into your lives. There's community, there's greater resources now than there were just a few years ago. COVID put this on steroids, and it's been a gift. I mean, I know it has for me and for my family and for the people I've been able to bring it to and talk to them about. Just opening up the discussion is a powerful, powerful tool. So I appreciate what all you guys are doing. I think it's good timing here. Ricardo's managed to hop on here. And
There he is.
evening, Ricardo.
You're on mute.
You're on mute, maybe. Yeah.
One
No.
sec.
There you are.
Hey guys,
Hey, how's it going?
going good. So sorry for being late and sorry for just hopping in real quickly, but I just could not miss this. And I want to first and foremost thank you, Todd, for putting this together and inviting me to be part of this amazing panel. This is serious stuff, and I'm thrilled to be part of this. I will have to leave momentarily, but I just wanted to hop on and say hi. Did everybody introduce themselves? Where are we at this point?
Yeah, we've had some good discussion. I know you only have a few moments, so I think if nothing else, you being here with us and kind of representing at least three of us on the panel have all had good and bad with ADHD and if nothing else, just tell us where you're at and what you see in the future. I know you're right now you're taking a class that's intimately related to this discussion, so we'd love just to hear a few words from you and how meaningful this is for you and your future.
Oh, for sure. Very, very meaningful. So as we discussed offline before, most of us, for me, it was a diagnosis at 56, and it was one of the most revealing, eye-opening, news that I could have ever received, because it just gave me it gave me clarity. It explained so many things that I just couldn't figure out why I was the way that I was. And yeah, so it's like a very powerful before and after, and as we've discussed in the past, and we've been talking about this in multiple lectures, it's fascinating how audiences in dentistry relate to this. And so how incredibly prevalent, having a neurodiverse brain it is in dentistry. And so I think we have a very bright future. I think the fact that we can acknowledge that our neural architecture vary from individuals, is amazing, because not every dentist is built the same way. Not every healthcare provider is built the same way. And I think understanding this intricate wiring does allow us to navigate more freely and to be able to, leverage all those amazing things that we have and realize where we're limited and work on those limitations. And so I think as we've talked about this so many times, Todd, the future is bright. And yes, right now I'm in school. I've embarked on a 3-year project, and I'll become what's called an existential therapist, which, if anything, what it does, and not that I'm going to be a therapist giving therapy, I'm just going to be a better clinician, better team builder, a better you know, father, a better friend, because I have now more tools that allow me to, you know, be active listener, not judgmental. I think if we just do that, we're in a much better space.
Yeah.
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 I like what
Yep.
you said. I like what you said there, Ricardo, is just getting some tools. And what's funny is that with dentists, we usually just focus on clinical tools. Just like get
Mhm.
better at doing sinus lifts, get better at prepping veneers, get better at doing smile design. And then we wonder why we're having all these problems is because we're not very diverse people. It's like we're good at clinical dentistry, and that's basically
Mhm.
it. And when you talk about how many dentists have done listening training, have done communication exercises, have learned how to do crucial conversations like what Martin taught me, you know, have learned how to manage teams, but like not just manage teams as a practice manager, but manage teams as a leader. How many of us have worked on our leadership abilities? How many of us are focusing on our physical health and thinking and you know thinking that there's no connection between your mental and physical health? I mean, so many of the things that a lot of us talk about with dentists are non-clinical because most dentists are pretty good clinically because that's all we've done our whole career. That's why we went to dental school. That's why we did our residencies. That's why we did all this stuff. We just clinic. And most of the problems that bring us down are not clinical. You know, like, yeah, I had complications that made me sad, but guess what? After I increased my mental health, my communication skills, I still had clinical complications, but it was how I handled them, how I talked to the patient, how I came home to my family. That was what changed. It's
Totally.
tools.
And you know, I'm hearing you. I'm thinking the one thing for the one part, it's us, but us striving to do better dentistry. I mean, if we want to be a better dentist, we need to understand our patients better. And we I hate to say this, but we're not good listeners. You know, there's a great book out there I think everybody should check out. It's called Compassionomics. There's data that shows that this is more physicians than dentists, but we're probably up there. You know, when patients are sharing chief concerns and whatnot, it takes physicians 11 seconds to interrupt patients. 11 seconds, you guys, for crying out loud. I mean, it's insane. And so if we don't know where the patient is at cognitively, emotionally, behaviorally, how you're talking about sinus lifts. I mean, how can we expect our dentistry to last if we don't understand where the patient is at behaviorally? I mean, we got to be much better at listening to ourselves, listening to our teams, listening to our patients, listening to our bodies, listening to our families. I
Yeah.
think that's essentially the cornerstone of mental health, everything.
And especially as our patient population becomes more and more complex with
Mm-hmm.
their own set of illnesses and risk factors, man, what better time to understand them more, right? Instead of just trying to get to that clinical procedure that we think we do really well, understanding what the patient's bringing to the table. You know, think about airway right now and how critical that is to truly understand someone's true level of wellness before we embark upon these complex therapies. It's absolutely critical. So I think, you know, I hope this was the case, but I think tonight we've certainly shown that this group of very successful five clinicians has all had battle wounds. We have battle wounds, and it was about our ability to share them with our colleagues versus hold them inside that really was our breakthrough. So that's step number one is let's everybody out there do that favor for yourself is talk about this, find someone to share it with. And if you really need help, there's resources out there to get them. But in this process of helping ourselves, we're going to have a profound effect on our patients and our teams. And I think that's really, I think our mission here is to help everybody be healthier from the mind to the soul. But with that, you're making a community for dentistry that we just have never had. So I think that's a mission well accomplished if we can strive for that. But why don't, as we're closing, because we only have about 15 minutes here, love to kind of just rotate around, maybe starting with you, Martin, because I know you have something to say, but then going right to Ricardo, because Ricardo's going to have to drop, and then Israel and Kyle. Let's just kind of, if you could wrap it up in 2 or 3 minutes, what are your closing thoughts for where we're at and where we're headed with this?
What I was going to say is actually perfectly related to a close, going back to something Ricardo said about listening and listening to each other, listening to our patients, listening to our bodies. And I've been very open about this. It was 2022. Obviously, if we all remember the timeline there, we were kind of starting to come out of the pandemic, and something still just wasn't right. And I was in therapy, and I had all the tools, and I have a certification in happiness studies that's now a master's. I don't have the master's, but whatever. And so, and something wasn't right. And so I listened to my body, and I went out. It's a long story short. I found prescribed ketamine therapy at home that has completely and totally changed my life, because it helped to reprogram some of the pathways, and I'll call them neural habits, that I had ingrained in myself over the years that served me to a point that no longer serve me. And I am a different person today. And so my closing thoughts are, we absolutely have to listen to ourselves. And even when we think things are going along and things are okay, sometimes they're not, and that's okay too. And just understanding that we all have stressors in life. Life can be very, very difficult at times. But in the words of Sean Akor, happiness is a comparative emotion. Excuse me, Tal Ben-Shahar. And so we need to understand that there's no way that we can embrace happiness without understanding the sadness, the trick, the magic, the beauty of having a life of whole being and wholeness is understanding that navigating through those negative days is actually part of our journey, so that we can then celebrate those days that are more filled with light. So that's kind of just the way I live my life today.
Yeah.
Love it. Love it. So just imagine for a second, just thinking or reacting to Martin's statement here. Just imagine what would life look like if we only had happy days?
Yeah.
I mean, could that ever happen? So that the fact that we're able to acknowledge those days that are not happy days publicly, the fact that we're able to have someone to talk to, and I guess this is to me the my 2 cents for those folks that don't have someone to talk to. There's so many avenues through which we can connect. I typically during our seminars, I ask, okay, so who has this figure, and call it a board member or a therapist, a coach, however you want to call this persona that's there periodically, where we can just vent and talk about what's going on, and then have a discussion which people can pick in our brains and kind of figure out where we're at. Because if this persona does not exist, and all of us here have obviously done the homework and are doing the homework, but if folks out there do not have this figure, this persona in your life, it's amazing when you take the time to look for this person, because now you periodically and consistently have someone that you can, just bounce ideas off. I think that's important. If there's no such a person, then it's hard to envision a way of kind of like getting clarity. The only way we can get clarity is if we bounce ideas. And again, as Martin said, I mean, there are good days and there are bad days. That's called life. And I think it was González Iñárritu, the director of Birdman, all these films. I listened to him in an interview saying, And it relates back to what you just said, Martin. Only through sadness can you truly understand, the true implications of happiness.
Mhm.
Right. So again, I mean, we're alive, right? Feeling alive is feeling all these different flavors. The problem is social media and this complete fake environment that we are attached to and sometimes addicted to, doesn't show that, doesn't show reality. And so that creates a false image of what life really is. So just a couple ideas there to noodle on.
Yeah, thank you.
I think that one theme that for me that sticks out amongst everybody who's spoken this evening is the power of self-awareness. That it's one of the keys to whether it be diagnosed with ADHD or with any other mental issue, psychological issue, stress, anything. It all comes down to self-awareness. That's what resonates for me. And I had a coach recently who is talking to him about something that would trigger me often, and I really couldn't get it out of my system of like, why does this trigger me so much? And eventually what did it is him convincing me to number one, be self-aware about it, and number two, be self-forgiving about it. Because if you're aware of it, you tend to be forgiving of yourself. And as soon as you are forgiving of yourself of, yeah, I'm going to get triggered over that, or I am getting triggered over that, you kind of develop a sense of humor about it. And if you develop a sense of humor about it, you move on, and it just becomes a little speed bump rather than a big mountain. And it stops triggering you, because if you can laugh about something, that's it. It's done. It has no power over you. And that is just totally being self-aware of, this triggers me, therefore I'm not going to care about it. And it's really kind of interesting how we can convince ourselves pretty easily in a lot of cases how not to get triggered over things that really seem very important.
Yeah, I think that, that's a great ad, is that, I've read a fair amount about cognitive behavioral therapy, and it seems quite simple, but putting it into action isn't.
Yeah.
So stubborn, and
Yeah.
you're set on your triggers, and that's the way it's created those neurochemicals again and again and again. I think you're so
So
right. It's learning to laugh about it and learning to give in a little bit is a great tool.
Yeah, for me, it
I
was
I
just
have
the
a
realization of like, yeah, okay, I could get triggered about that. Big deal. And that
yeah.
was it.
I have a tool for Israel and everybody else. This is coming out in my book, but it's notice, breathe, commit, and then act. NBCA. Because committing between your ears is not the same thing as executing. So notice, breathe, commit to a different path, and act. And that's exactly what I heard you say.
Yeah.
So you can live between the space.
Yeah.
Kyle, you want to give us some closing thoughts?
Yeah, I think if people could leave this and just have awareness, that is a huge step. I have a framework that is kind of in the background of everything that I teach, and it's called Ripple. And so you realize there's a problem, you realize who you are, step one, which is basically what we're doing today. The next step is identify, which is exactly what Israel was talking about. Identify your triggers, because you can't live between that space that Martin was talking about if you don't even know what it is that the stimulus is that's triggering you. Then we go to purpose and perspective, which we could go deep into, but I think a lot of us think that dentistry is our purpose in life, right? Then we go to the learn, and learning is daily habits that I think a lot are on social media now. It's kind of becoming trendy to do these daily habits, but there is a shit ton of research behind every single one of these. A lot of people think that it's like fluffy woo-woo stuff, but there is good multi-center scientific research on all of these. And the last one is to elevate. And that involves what you do in your practice, what you do in your profession too. And a lot of that really comes down to three things, which is boundaries, expectation, and communication. When I looked at my downfall and now, you know, my slope of enlightenment that I'm on, it wasn't that I was a bad dentist. It was that I wasn't good at setting boundaries. I wasn't good at setting expectations, and I wasn't good at communicating. And once I boiled all of that down, and I was just like, oh my gosh, that's it. That was everything. And so that's what I worked on. And so I worked on those three things, and my whole life changed. And so I think my final thought with this is just, don't think being a good dentist is going to make you have sustainable success in your life and in your career.
Yeah. Awesome.
Awesome. Guys, I gotta run, guys.
Ciao.
Love you. Take
All
care.
right,
Okay.
Rodo.
All right,
Yeah.
Rodo.
Take care. Yeah, so in kind of my closing thoughts, I want to bring up one other thing that's really profoundly affected me in my journey, and that was really getting in touch with the subconscious. It took me a physician, a change from the traditional physician to a functional medicine doctor to really dive down into what was driving my dark days, and that was a lot of stuff, not just my daughter, but a lot of stuff I had put aside, thinking it was all good and I was going to be just fine. That had to boil up, and to find a physician, Dr. Ron Chen. You'll hear about this guy. He's a brilliant guy and is doing amazing things for medicine, because we all know that if we think dentistry has some bad sides to it, medicine, man, they're band-aiding everything and really not getting to the root of the problem in our healthcare system. So we have to break away from that and talk about a task, right? It's obviously a huge task to manage mental wellness in dentistry, but dealing with chronic diseases in medicine is gargantuan. And I've just found myself that there's really awesome tools with the right healthcare providers to help us through these things. And we've got to get in touch with that subconscious and our spiritual side to really to get there, to open up and just let things really roll out that are not the routine, not what we've been taught, not what we thought was okay, but to really bring it to that next level of becoming a healthy mind. So I think, this is the beginning of a long discussion. I hope, guys. I think that all of us do a lot for dentistry. In other ways, it's time now to make this a real big part of what we're teaching, or at least talking about. Maybe we're not as qualified myself to teach this, but we at least need to open that discussion. So thanks for joining me tonight. What a great week to do it on the cusp of Thanksgiving, where we're all thankful and thinking about thankfulness. This to me is an awesome thing to have, the four of you, to join us and open this discussion and try to get it out there. We had some technical difficulties tonight. I know we could have hit a lot more people live tonight through our Instagram channels. I'll take the fault for that, but we've recorded this and we will regurgitate it, and we will come back again and have another discussion about the power of community, the power of banding together to help each other out to make our lives more happy. So thanks, guys. Really can't thank you enough for this, and have a blessed Thanksgiving holiday and joyous Christmas coming up, and we'll hopefully pull this group back together in 2025. But
Let's do it.
Yeah, let's do it.
All right, guys. Have a good night.
Guys.
Take care.
Good.
Bye.
All right.
Thank you, guys.